Safe and connected is the way we do things at CALHN. It's the way we do things to make sure that we keep our staff safe and our patients safe, that we connect all our teams and we have a connected patient journey. When a patient needs our care at CALHN, there are lots of teams that actually look after them. Often it might be the emergency department team and the inpatient team, and then say the hospital and the home team. For our patients, we need those teams to be seamlessly connected so that the information and the care of that patient feels connected. It's not for the patient to connect those dots, it's for us as an organisation to connect those dots. And Safe and Connected gives us a framework and a way of doing that so that patients do not notice the handoff between teams or the change in their care environment. All they experience is seamless care.
It's about ensuring that we have aligned goals, that we know that the rhythm of the organisation is a certain way so we can communicate up and down in the organisation. We know that we have suitable problem-solving tools to ensure that we can solve our own problems and only escalate where we need to. That we have connected leadership, which is around ensuring that all of us in our roles have the ability to help support one another and influence things to get better outcomes. And the final one being clinical excellence. And again, the whole operating model in essence is really about ensuring that we are able to deliver clinical excellence to our community.
By having the safe and connected huddles and mentality, I think everyone knows what that common goal is and knows the plans for the day. That certainly translates in patients getting to where they need to be sooner and making sure that the care that they require is provided in a more timely fashion, and that we can prioritise sort of what the day looks like and who we see first, who we move first. This all means that patients are getting sort of a more timely care, hopefully discharging earlier as well.
So down in the NOC, through some of our TOC accelerator work with Safe and Connected, we've seen an increase in people going through the transit unit. We're hitting some of our highest numbers through the transit unit. And we've also seen an increase of patients moving out of ED between 6 and 9 a.m. in the morning to create that early decant to allow access throughout the day into the ED department. So we've had some really big wins with the help of the whole organisation getting on board and following process.
I think the team feel more connected to the organisation and each other as a program, and then even across other programs we are more connected because we have the same ultimate goals.
Safe and Connected has improved the experience for our allied health staff. I'd say both on the front line and our leaders, with information getting through to our staff more instantly. Before Safe and Connected as an operating model was introduced, there would often be a lag in critical information such as IT systems or where there might be issues about stock or things impacting our ability to deliver care. The staff are reporting now that they are hearing those messages much more instantly and also able to raise them up when they need some support.
More importantly, it's about having continuity of care, so ensuring that our staff are actually built into our resource bank and able to then provide the consistency of care to those patients. So I think the Safe and Connected model has meant that we are all talking about the same thing, which therefore means that we're getting the depth and breadth into the organisation. So it's improved clinical decision making, it's improved use of resources, and it's improving our bottom line.
Our efficiencies have really improved, so we are able to actively problem solve and have timely resolution of issues that are escalated.
For Safe and Connected to work, everyone's voice must matter. If you think about the patient that comes in the front door of the hospital, so many people are needed to deliver care. It's the cleaners to make sure that our environment's clean. It's the ward clerks to make sure that they're checked in properly. It's the security guards to make sure our environment's safe. It's the maintenance people, the BME people to turn on the lights, to keep the water running, to make sure that things are kept cool and safe. It's for all our clinicians that deliver the clinical care to that patient. It's for our chaplains, it's for our volunteers. So for Safe and Connected to work, everyone in the organisation must have a voice and all be connected to an aligned goal of delivering patient care.
I'm really excited for the future of CALHN because of all of the skills that we've learnt with the Safe and Connected model. We'll be able to continue using these skills and continue problem solving into the near future.